Civil society organizations as well as various faith-based groups and religious leaders have welcomed an engagement with the Deputy Minister Paul Mashatile, as well as members from government, of course, dealing with creating a better society. A short while ago we spoke to the Deputy President saying that it's imperative that religious leaders and the faith community has a voice in terms of government, and also to make sure that the ideals that we strive for in the Constitution are indeed realized. I'm joined now by the chairperson of the South African National AIDS Council, Steve Letsike. In terms of this engagement today, and in terms of the issues that civil society or the faith-based communities are bringing to the table, what exactly would you like government to focus on? Because we've heard from various leaders that drugs within communities are talking about rape among children, talking about teenage pregnancies, the elderly that are suffering. So as your organization, what issues are you bringing to the government ears listening here today?
Indeed, thank you so much. And we welcome this initiative by Deputy President Paul Mashatile. He's also the co-chair of the South African National AIDS Council, responding to the public health challenges, HIV, TB, STIs. We dealt with COVID successfully in terms of how we needed to respond to it. Now, in order to deal with some of the public health threats, we must address the social and structural barriers. And part of that, you can't do it alone or in silos. The multi-sectoral response is always needed. You have the role of government, you have the role of civil society and private sector. And what we say is actually about elevating and ensuring that there's coherence, there's consistency, but also there's urgency in putting the needs of people first, and how we actually educate people in responding, in changing their behavior in all of this. Government has successfully for the last couple of years demonstrated that we'll put resources where the mouth is, but now we need to actually show progress, and we want to show what we can do more together. There are solutions everywhere.
We often hear from people, especially those making use of, public healthcare facilities, that it's not quite where it should be. We hear the complaints, we see people, waiting forever to be assisted and so on. And of course, this, I suppose, is also something that you are bringing to government to get their attention. I know that's specifically on health, but of course, these are the kind of issues that communities would like government to address with urgency.
And which is very important. What we have raised is to say that we cannot have a public service that is complacent. In fact, if people do not want to work, they really must excuse the public service, because we want a public service that is responsive, that is strengthened, but that also is responding to the needs of people. And where there's a need for accountability, we must strengthen it. And what we see across many society, it's challenges because the demand is more, the epidemics, the illnesses are growing, because also it speaks about people's behavior. So we are not going to shift responsibility and put it across into government. We also must speak about our own responsibility. But what we have said as civil society said, we are part of the solutions. And that's why every single day, community-based organizations, faith-based organizations are having sleepless night to actually support the work of government.
I thank you so much for your time. Of course, you're the chairperson of the South African National AIDS Council, talking about civil society, their take on this engagement and engagements like these, and also how ordinary South Africans, faith-based communities, can hold hands with authorities to ensure that the society is one free of the social ills that we often experience in this country.